Why is Nimbus COVID variant spreading so quickly? Health officials in the United States are warning about a new COVID-19 variant known as NB181, or Nimbus. It is now responsible for more than 40% of reported cases and has been detected in 45 states. The nickname comes from the way patients often describe a thick, cloud-like pain in the throat. While it appears more transmissible than earlier strains, scientists say there is no clear evidence that it has caused more severe illness or higher rates of hospitalization. The Centers for Disease Control and Prevention, CDC, reports that most cases are mild to moderate, with symptoms including fever, cough, and severe sore throat. Another variant called XFG or Stratus has also emerged but remains far less common and is not considered a major public health threat. Experts stress that testing and genomic sequencing are critical for tracking how these variants evolve and spread within communities. Public health advice remains consistent. Vaccinations and booster shots continue to provide strong protection against serious illness. Wearing a mask in crowded indoor spaces, improving ventilation, and staying home when feeling unwell can all help reduce transmission. The CDC encourages people to remain cautious, particularly in areas where case numbers are rising quickly, to avoid another period of uncontrolled community spread.